Imagine a silent whisper, an invisible force moving unnoticed through a woman's body, leaving behind only the faintest clues of its presence. Unlike infections that cause immediate, dramatic symptoms, HIV often begins subtly, its early warning signs easily mistaken for common ailments or stress-related fatigue. For many women, these early symptoms go unrecognized, delaying crucial medical intervention and increasing the risk of unknowingly spreading the virus. Understanding how HIV manifests in women is not just a matter of personal health. It's a vital public health issue that requires greater awareness, education, and proactive testing. Welcome to Healthy Life Channel, where we explore vital topics to keep you well-informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. While HIV affects both men and women, its symptoms and progression can differ significantly between genders. Women often experience more vague or nonspecific symptoms, which can make diagnosis more challenging. Additionally, hormonal fluctuations, reproductive health factors, and differences in immune response affect the way HIV develops in the female body. Before we dive in, take a moment to hit that like button. Every like helps this video reach more people, including those who might not have easy access to medical care and could even save a life. Share it with your friends and family, and let's spread awareness together. Also, I'd love to know where you're watching from. Drop a comment below and say hello. Now let's get started. The initial stage of HIV, known as acute HIV infection, occurs within 2 to 4 weeks of exposure. During this period, women may experience flu-like symptoms, including fever and night sweats. Persistent low-grade fevers and sudden, intense night sweats may occur as the immune system reacts to the virus. Swollen lymph nodes. The lymph nodes in the neck, armpits, or groin may become enlarged and tender as the body attempts to fight the infection. Fatigue and weakness. Profound, unexplained exhaustion is common, even after adequate rest. Skin rashes. Red, itchy rashes or dry patches may appear, often mistaken for allergic reactions or skin conditions. Sore throat and mouth ulcers. Painful throat irritation and persistent ulcers inside the mouth can be an early indicator of infection. These symptoms often resolve within a few weeks, leading many women to dismiss them as a passing illness. However, even after symptoms fade, the virus remains active, gradually weakening the immune system over time. As HIV progresses into the chronic stage, symptoms may become more persistent, often affecting reproductive and overall health. These can include frequent yeast infections. Recurring vaginal yeast infections may indicate immune system suppression. Menstrual irregularities. Changes in menstrual cycles, including missed periods or heavy bleeding, can be linked to HIV's impact on hormonal balance. Pelvic inflammatory disease, PID. More frequent or severe cases of PID, a painful infection of the reproductive organs, may occur. Weight loss and muscle weakness. Unexplained weight loss and decreased muscle strength may signal a decline in immune function. Chronic diarrhea and digestive issues. Ongoing gastrointestinal discomfort, nausea, and diarrhea are common as HIV affects the digestive system. HIV is not just an individual health concern. It's a global and national public health crisis. According to the Centers for Disease Control and Prevention, CDC, women account for approximately 19% of all new HIV diagnoses in the U.S. However, the impact is not evenly distributed. African American and Hispanic women face disproportionately higher rates of infection compared to their white counterparts. This stark disparity is driven by socioeconomic barriers, healthcare access limitations, and systemic inequalities that put certain communities at greater risk. HIV rates vary significantly across the U.S., influenced by healthcare accessibility, public health policies, and social factors. Below is an overview of some of the most affected states and their unique challenges. Georgia, high urban transmission rates. Atlanta and other urban centers report some of the highest HIV transmission rates in the nation. Factors such as economic disparity, limited healthcare access, and lack of awareness about preventive measures contribute to rising infections. Expanding free testing sites, community outreach, and educational programs is essential to reducing HIV rates among women. Florida, disproportionate impact on women of color. Florida has a high concentration of HIV cases among Black and Hispanic women. Many face additional challenges, including economic instability and racial healthcare disparities, making it harder to access consistent treatment. Community-led initiatives focused on education, testing, and treatment accessibility are vital to reversing this trend. California, progressive prevention strategies. California has implemented some of the most successful HIV prevention programs in the country. Widespread access to pre-exposure prophylaxis, PrEP, free testing, and educational campaigns has led to a notable decline in new infections. This model demonstrates how proactive public health measures can make a real difference. New York, comprehensive healthcare support for women. New York has one of the most advanced HIV healthcare infrastructures, with strong treatment programs, mental health support, and stigma reduction campaigns. These initiatives have led to improved survival rates and quality of life for women living with HIV, serving as a model for other states. Early detection and treatment are critical to managing HIV. Advances in antiretroviral therapy, ART, mean that HIV-positive women can lead long, healthy lives if diagnosed and treated early. However, awareness and accessibility remain major challenges. Stage 1. Acute HIV infection, the silent invasion. 2 to 4 weeks after exposure. The first stage of HIV, also known as acute retroviral syndrome, ARS, or primary HIV infection, occurs within the first few weeks after contracting the virus. During this period, the virus rapidly multiplies and spreads throughout the body, triggering an immune system response. Many women experience flu-like symptoms, but since these signs resemble common viral infections, they are often overlooked or misdiagnosed. Common symptoms in the acute stage. 1. Mild to high fever. One of the earliest and most common symptoms of HIV is a fever, which typically ranges between 100.4 degrees Fahrenheit, 38 degrees Celsius, and 102.2 degrees Fahrenheit, 39 degrees Celsius. The fever may be accompanied by chills, night sweats, and body aches. This occurs because the immune system is reacting to the virus as it spreads through the bloodstream. 2. Extreme fatigue. Unlike normal tiredness from a busy schedule, HIV-related fatigue is often severe and persistent. Women may feel exhausted even after a full night's sleep, making daily tasks difficult. This fatigue results from the immune system working overtime to fight the infection. 3. Swollen lymph nodes. Lymph nodes, located in the neck, armpits, and groin, are key parts of the immune system. When they become enlarged, tender, or painful, it is a sign that the body is fighting off an infection. While swollen lymph nodes can occur with many illnesses, persistent swelling without another clear cause could indicate early HIV. 4. Persistent sore throat. Unlike a typical sore throat from a cold or allergies, HIV-related sore throat lasts longer and does not improve with common treatments. It may feel raw, scratchy, or painful, making swallowing difficult. This symptom results from immune system activation and inflammation. 5. Muscle and joint pain. Aches and pains in the muscles and joints are common during the acute phase of HIV. These symptoms may be mistaken for the flu, arthritis, or physical overexertion. The pain is caused by the body's inflammatory response to viral replication. 6. Unexplained skin rash. HIV rashes can appear suddenly and may look like red patches, small bumps, or itchy lesions on the skin. These rashes can be localized or spread across the body and may come and go. Unlike common rashes, HIV-related rashes do not always respond to over-the-counter treatments. Many women mistake these symptoms for a seasonal flu, a cold, or even stress-related fatigue. As a result, they may delay getting tested for HIV, allowing the virus to progress unchecked. If you experience these symptoms and have had recent exposure to HIV risk factors, such as unprotected sex or shared needles, seek medical advice immediately. Early detection through HIV testing can lead to better treatment options and improved health outcomes. Stage 2. Chronic HIV infection, the silent phase. After the acute phase of HIV passes, the virus enters a prolonged period of dormancy, quietly replicating within the body. This phase, known as chronic HIV infection or clinical latency, can last several years. Unlike the acute stage, where symptoms can be intense and flu-like, the silent phase is more insidious, with subtle but persistent changes in a woman's health. During this stage, HIV is still active, but the immune system manages to keep it under relative control. However, as the virus slowly weakens immune defenses, certain chronic health issues begin to emerge. Many of these symptoms are mistakenly attributed to other conditions, making early detection even more challenging. Symptoms of chronic HIV infection in women. 1. Persistent vaginal yeast infections. Women with chronic HIV often experience frequent and stubborn vaginal yeast infections. Symptoms include severe itching, burning sensations, and thick white or yellowish discharge. Unlike regular yeast infections, these episodes do not respond well to standard antifungal treatments and tend to recur within weeks or months. This happens because HIV weakens the immune system, making the body more susceptible to opportunistic fungal infections. 2. Recurring urinary tract infections, UTIs. Women may suffer from repeated UTIs, often within short intervals. Symptoms include painful urination, frequent urges to urinate, and lower abdominal discomfort. Many women require multiple rounds of antibiotics, yet the infections keep returning. This increased susceptibility occurs because HIV disrupts the balance of beneficial bacteria in the urinary and vaginal tract, making it easier for infections to thrive. 3. Menstrual cycle irregularities. HIV can cause hormonal imbalances, leading to unpredictable menstrual cycles. Women may experience missed or delayed periods, prolonged, heavy bleeding, and unusual spotting between cycles. The immune system's interaction with hormones like estrogen and progesterone may be disrupted, affecting reproductive health. 4. Unexplained weight loss. Without changes in diet or physical activity, women may lose weight rapidly. This is known as HIV-associated wasting syndrome, where the virus affects metabolism and nutrient absorption. Weight loss often signals that HIV is progressing, even if other symptoms seem mild. 5. Mild but persistent skin problems. Chronic rashes, dryness, and small acne-like bumps may appear on the skin. These symptoms do not clear up with standard skincare treatments. The presence of fungal, bacterial, or viral infections on the skin suggests that the immune system is struggling to fight off minor infections. 6. Increased susceptibility to bacterial and fungal infections. Women with chronic HIV become more prone to infections that would normally be minor or easily treatable. This includes frequent colds, persistent sinus infections, bacterial skin infections, and oral thrush, a white fungal coating on the tongue and inner cheeks. This heightened vulnerability indicates progressive immune system deterioration. Stage 3. Recognizing the transition to AIDS. If HIV remains untreated, it eventually progresses to AIDS, acquired immunodeficiency syndrome, the most advanced stage of the disease. At this stage, the immune system is critically weakened, making the body extremely vulnerable to life-threatening infections and complications. 1. Severe unexplained weight loss, HIV wasting syndrome. AIDS leads to rapid and dramatic weight loss due to loss of appetite, chronic diarrhea, and digestive issues and metabolic imbalances that prevent the body from properly absorbing nutrients. This condition is known as HIV wasting syndrome, a hallmark sign of advanced disease. 2. Persistent oral thrush, fungal infections in the mouth. Thick, white, patchy lesions develop in the mouth and throat, causing pain and difficulty swallowing. This fungal overgrowth, caused by candida, is a sign of severe immune suppression. 3. Frequent and severe pneumonia. Pneumocystis pneumonia, PCP, is a life-threatening lung infection that frequently occurs in individuals with AIDS. Symptoms include severe cough, chest pain, and extreme difficulty breathing. Without immediate treatment, PCP can be fatal. 4. Profound immune system breakdown, dangerously low CD4 counts. CD4 T cells, immune system protectors, drop to critically low levels, leaving the body unable to fight infections. Even minor illnesses become life-threatening due to the lack of immune response. 5. Neurological complications and cognitive decline. HIV-associated neurocognitive disorders, HAND, can cause memory loss and difficulty concentrating, confusion or disorientation, and loss of motor coordination and muscle weakness. Some women experience severe depression, anxiety, or other mood disturbances due to the neurological effects of HIV on the brain. Recognizing these late-stage symptoms is critical for seeking immediate medical intervention. While AIDS is life-threatening, antiretroviral therapy, ART, can still improve quality of life and slow progression. HIV in women is often diagnosed late due to the subtle nature of early symptoms and the overlap with common gynecological issues. Early testing allows for better disease management, reduces complications, and significantly improves long-term survival. Regular screenings, especially for HPV, STIs, and reproductive health issues, are essential for HIV-positive women. With proper treatment, women living with HIV can lead healthy, fulfilling lives and even safely plan pregnancies. If you notice persistent vaginal infections, irregular periods, unexplained weight loss, or recurring infections, get tested for HIV immediately. Early intervention can save lives. HIV testing and early detection, a crucial step for women's health. Timely and accurate HIV testing is essential for early detection, effective treatment, and improved long-term health outcomes. Women have access to various testing methods, each with its own advantages in detecting the virus at different stages of infection. These methods include antibody tests. These are among the most commonly used HIV tests, detecting antibodies that the immune system produces in response to the virus. They can be performed using blood samples or oral fluid swabs. While effective, these tests may not detect very recent infections, as it can take weeks for the body to generate detectable antibodies. RNA/DNA tests, nucleic acid tests, NATs. Unlike antibody-based tests, these detect the virus's genetic material directly in the blood. NATs can identify HIV within days of exposure, making them particularly useful for early diagnosis. They are often recommended for individuals with recent high-risk exposure or for newborns born to HIV-positive mothers, as maternal antibodies can interfere with traditional antibody tests. Combined antigen-antibody tests. These advanced screenings check for both HIV antibodies and the P24 antigen, a viral protein that appears in the bloodstream shortly after infection. This combination test significantly improves early detection, as it can identify the virus before the body has had a chance to develop antibodies. At-home testing options. For those who value privacy or accessibility, at-home HIV test kits provide a convenient alternative. These kits typically involve collecting an oral swab or a small blood sample via finger prick, and either sending it to a laboratory for analysis or obtaining rapid results at home. While highly effective, individuals with positive results should seek follow-up testing at a healthcare facility for confirmation. The window period refers to the time between potential exposure to HIV and when the virus becomes detectable by a test. This period varies depending on the type of test used. Antibody tests may take 3 to 12 weeks, approximately 21 to 84 days, to produce accurate results. Antigen antibody tests can detect HIV as early as 18 to 45 days post-exposure. NATs, RNA/DNA tests, are the fastest, capable of identifying HIV within 10 to 33 days after infection. Because testing too soon may lead to false negatives, individuals at risk should undergo repeat testing if exposure occurred recently or if initial results were inconclusive. Current HIV research. Advancements offering hope for women. Leading research institutions across the United States are making remarkable progress in HIV treatment, prevention, and potential cures. Some of the most groundbreaking efforts include National Institutes of Health. NIH scientists at the NIH are exploring gene therapy and immune system modifications that could potentially eliminate HIV from the body or render it non-infectious. Johns Hopkins University. Researchers are working on targeted treatment strategies designed to optimize antiretroviral therapy, ART, outcomes, minimize side effects, and enhance overall patient well-being. University of California, San Francisco, UCSF is at the forefront of research focusing on HIV progression in women, investigating how biological and hormonal factors influence the virus and developing gender-specific treatment approaches. While there is still no cure, these advancements bring hope for longer, healthier lives for individuals living with HIV. Preventing HIV requires a multifaceted approach, integrating medical advancements with informed personal choices. Women can significantly reduce their risk through regular sexual health screenings, early detection of HIV and other sexually transmitted infections, STIs, helps prevent complications and onward transmission. Pre-exposure prophylaxis. Prep a daily medication that drastically reduces the risk of contracting HIV, especially for women at high risk due to a partner's HIV status or other exposure factors. Understanding personal risk factors. Knowing how different behaviors, such as unprotected sex, sharing needles, or having an untreated STI, influence HIV risk empowers women to make informed choices. Open communication with healthcare providers. Honest discussions about sexual health, contraceptive needs, and HIV prevention strategies can ensure women receive the most effective guidance and care. Protection during intimate encounters. The consistent use of condoms or other barrier methods remains one of the most reliable ways to reduce HIV transmission during sexual activity. HIV in women is not just a medical condition. It is a story of resilience, strength, and the power of knowledge. With continued scientific advancements, preventive measures, and access to treatment, women living with HIV can lead fulfilling lives. Every test taken, every treatment pursued, and every conversation had about HIV awareness is a step toward a future where the virus no longer defines a woman's potential. As we wrap up, remember, knowledge is power and awareness saves lives. If you found this video helpful, hit that like button to help it reach more people who might need this information. Share it with your friends and family, because you never know who might benefit from it. I'd love to hear your thoughts. Drop a comment below, and let's keep this conversation going. And if you haven't already, subscribe and turn on notifications so you never miss out on vital content like this. Thank you for watching. Stay informed, stay safe, and I'll see you in the next video.